So welcome back, everyone. I'm excited about bringing on my next guest. I absolutely love this team. I have with me Helen and Jennifer Walker. They are the owners of Walker and Walker Health Care Advisors, okay? And I want to talk a little bit first about you, Jennifer. We've talked about Helen a lot, but I want to talk a little bit about you. Obviously, you're a team, so we're going to talk about that for a minute, but then how you got where you are today from where you started.
Perfect, yes. So I started off in healthcare fresh out of school, and something simple, just customer service, answering questions about people's benefits. So that's how I kind of got into the game. And then went around, did different things. For a little bit, I actually worked for the pharmacy company, so knowing the ins and outs of how that works. But the last 10 years before I got into this, I was running a claims department. And when I say run the department, we had everybody reporting to me, from the folks that opened your mail and did data entry, the claims processors themselves. We had some customer service folks that talked about the claims benefits with the doctor's offices. And I also had provider representatives, provider relation representatives, where they were the liaison between the doctor's offices and the insurance company.
And they all talked to you.
They all talked to me.
So you were the meat and the potatoes that kept it together.
Yes. So a very interesting background of understanding from the insurance company perspective, understanding from the doctor's office perspective. So I had those two pieces of the puzzle already, where meeting with my mom, she understood it from looking out for the consumer.
Mm-hmm.
So getting all those three things together when I decided to go ahead and join her was an interesting caveat, because I understood from the other end. So when you've got people that are asking questions, why is my claim not being paid? Why do I have to get these authorizations? Who's the one that's approving these anyway? I could give those answers. I can tell you exactly how that works. I can tell you, hey, there actually are nurses that are looking at things when you're trying to get an approval from the doctor's office. It's not just Joe Schmo from down the street. Sometimes
Seems like
doesn't
it.
Understand. And it really does sometimes.
It does.
From the pharmacy perspective, when they have you get those authorizations, what that looks like, letting you know that there are actual pharmacists that are looking at that. Once again, somebody else, and you don't understand how it works. And so even to this day, I have clients that'll ask me, hey, I got this bill. What does it mean? What do I do? And I can kind of tell them from the other perspective, these are the different steps you have to take.
Well, it's awesome, because not only do you help people understand Medicare, which is already difficult to start with, you have all of the recipe ingredients that it takes to do a deep dive.
Yes.
And I think that's really important, because you said before you came on, there's some things that have been happening, but you've been getting some calls on, and we're going to talk about those things in just a little bit. But when there's questions, it's nice to be able to go to somebody who really truly understands even the question.
Yes.
Right? I think that's the biggest part right there,
And it can be overwhelming, to say the least, when you don't understand exactly what's going on. I had a client call me on Friday because they got a letter and they didn't understand what the letter was trying to tell them that they needed to do.
Mm-hmm.
So we went through the letter, understanding what it was, and she had an opportunity to change her plan for completely different reasons. So we talked about what those changes were, how they benefited her, and then went over her new options. But she's like, I got this letter, and then I got something else. What is this? And so we went through step by step.
This is why it's so important to speak to somebody local. That's right there, huge. Because when you're working with them, they'll be able to go over and understand your needs. She's obviously also was a client already too,
Yes.
so you knew her, right? And how important is that for people? I know for me, I'm sick and tired of calling and not being able to get somebody who understands me, right? And so folks, here's the thing. Number one, when you are getting any kind of mail or what have you, don't just throw it away. right?
Correct.
I mean, open it and let's read it, and if you have any questions whatsoever, I think calling and getting that advice is wonderful. I don't even know if people open their mail truly.
Well, and it's kind of funny because I've got some clients that they know I'm going to tell them what it says. So they'll be like, hey, this is from such and such. Is this junk mail or should I open it?
I love that.
And they'll ask, is this just an ad? And sometimes it's just an ad.
Right.
And they're trying to get you to call.
Mm-hmm.
But we've got that relationship where they know it's okay to call me just to ask something simple like that.
Right.
Is-
Let me give out your information because this is important. The number to call is 602-750-0620. There is no charge, there's no fee for them to work with you, okay? Any phone call, any questions that you have, they welcome them,
Yes,
right?
that's very true.
And you work statewide, and their website is Walker Healthcare Advisors with an E.com. Let's talk about that, because a lot of people you mentioned that might be getting spam, they don't know
Yes.
what it is. Don't do anything. Don't just call, don't just click on, let's say, they have a website or whatever, don't just go to it. Even if it looks official, what do you think?
Very true, unless it's something that comes from Medicare.gov.
Okay,
Or socialsecurity.gov. Sometimes it's masked and it looks very official, but you have to really pay attention. And if you're not sure, call us and we can tell you exactly what that is. My client, it was something from Access, from the state, and she just wasn't quite sure exactly what was going on, so we were able to walk through that. Sometimes it looks very official, but then all of a sudden there's a name and a phone number to call at the end, and it's not 1-800-MEDICARE, so if it doesn't say 1-800-MEDICARE, it's not Medicare, it's an agent like myself, and some of them aren't gonna be as honest, and they're gonna tell you what they think you wanna hear just to change your policy versus going through the process and really explaining to you, these are what your options are, let's look at what you're currently on, and what's the best thing for you. I had somebody that referred a friend, and he had options. It was, I can stay on my wife's employer plan, or I can go ahead and go on Medicare, and we literally went through the steps to see from a financial outlay what made the most sense. And after we were done, I told him, you're better off staying on your wife's plan from a financial outlay. And in a couple years when she's ready to retire, we'll revisit this conversation. But the important thing was, let's build this relationship and let's be honest about what's going on and what's going to be best for you. And what was best for him meant that we weren't going to work together right now, but we'll work together in a couple of years.
the number to call is 602-750-0620. Now, open enrollment, okay?
Yes.
It got so confusing, open enrollment again. Okay, so it ends, you said, March 31st. That's around the corner. What do they need to do?
Yes. For those of you who are already on Medicare and you're on an Advantage plan, this is specifically for you. If you have not already tried to change your plan and you want to, you only have 2 more weeks. So in that 2 weeks, you want to give us a call. We'll look at your current plan, we'll find out what else you're looking for, and then we can see if there's another plan out there that's going to better suit your needs.
The other thing is, too, is a lot of people's plans are going up, of course.
Yes.
And you can get some answers when we come back and after we go to a break, because that's another thing that you said that you're getting a lot of calls on as well. Hey, folks, listen. They made it kind of hard in the first place with Medicare because it is extremely, it's difficult to understand because there's so many pieces to it, okay? I want to go to somebody who's going to be able to help me in every aspect, which is what you bring to the table. And really, I appreciate that you do have, and your education on it, And to me, I think that's wonderful that you have all of those. And you forgot to say, I know you said doctor, but you also did pharmaceuticals. So
Yes.
that's another thing that you know. And when it comes to your medications, that's number one with the folks out there. They don't want to
Yes.
pay a lot of money. They need it, and they need it now, and they need to know how they can get it to be the as least expensive as possible.
Very true, and there's definite ways when it comes to those medications. Sometimes you think you're just stuck in this one box, and they don't realize that there's other options for you when it comes to your medication.
Solutions is what we have been talking about today. And here's the thing, they are statewide, and it is no fee to you whatsoever. So call them. Their phone number is 602-750-0620. They work statewide. Again, this is no charge to you, the families. Their website is Walker Health Care Advisors with an E.com. Hang tight, we're going to be back in just a minute. Will you be my agent? She liked what you said. Anything else that I need to talk about?
No, we can definitely talk about the supplement plans next. Those are the ones that people are starting to get the letters about rate increases.
Don't give them too much hope, because if they got health problems, they're not going to be able to switch from one plan to another.
Do you want to talk about that?
We'll still talk about it and just let them know we can look at what their options are.
Okay.
Well, because there's some folks that are out there that are healthy, and those rates
I
are
just
going
really-
up.
I don't like to get false hope, but they definitely have options, so that
Yeah.
they're not to feel this stuff. Some of them are, but
About their drug plans, right?
Well, this is
The
their
supplement.
medical plans,
Oh,
the
their
supplement. So they're getting these rate increases for their medical piece of it.
now they're stuck with their drug plan.
Question though, because a lot of people, I don't think people, they tend to not care as much because it's coming out of their
Social Security.
Social Security, yeah, because they don't have to
Look at
pay,
it.
Yeah.
you know, it's like, oh, well, what's another $10 or whatever,
Yeah,
and they
outside of-
probably don't really care, but
Some of them don't even know it's coming out.
they don't, and they don't.
They don't review it, and they don't look at it. They're clueless on how much they're paying for their drug plan. Yeah.
That's
You know,
too
I
bad.
had a client that we literally just changed because they got their letter and it was gonna go into effect April 1st. And it was double-digit increase as far as a percentage. And it was $70. And so we looked. A month, yeah, change. So we looked and were able to find something else, same letter of the alphabet, but he was able to answer the health questions to pass, and so we got him a different plan that saved him.
I think that's what's make you're a broker, right? And I think that's where you come in, where, you know, it'll be the same type of a plan, maybe a different
Carrier.
Carrier.
It is the same. It is the same plan, just a
but just a
different
different
carrier.
Yes.
carrier, and you help them save money, because I don't care, $70,
It
is
doesn't
$70.
matter.
Yeah,
that's a
especially
month,
to a
yeah,
senior.
It's a month. Yeah.
Mhm, exactly, I know, I heard ya.
So we joked about them going to lunch afterwards. I was like, I just saved you money, you can go to lunch now.
What was that?
I told him, I was like, I saved you enough money, you can go to lunch now. So they were gonna head out and go to
That's
lunch. Anything else we want to talk about?
You can let them know they can change your primary care through the year.
Yelling.
Oh, I'm sorry.
So welcome back, everyone. You know, Medicare. Some people think that Medicare is just for October, right?
Mm-hmm.
It's really not. It's all year round, right? And one of the things that we were talking about that you wanted to talk about was people's supplement plans.
Yes. So for those of you, we just got through talking about those that are on Advantage plans. For those of you on a Medicare supplement, letter of the alphabet, Plan G, Plan K, those plans, now's around the time that a lot of the carriers are doing their annual rate increase. So your monthly premium that may be coming out of Social Security or coming out of your checking account, whichever one, you're getting these notifications that's letting you know exactly how much the increase is gonna be. These past couple of years, we've seen a large increase in what it was. It used to be single-digit numbers was the increase. As of late, we were doing double-digit increase. So I just had a client that it roughly about $70 a month increase was coming. And so the question was, well, Jen, what can we do? What are the options here? And so it does depend when you're on a supplement plan, you gotta be able to answer health questions. But as long as you satisfy the carrier with those health questions, you do have the option to seek out and see if there's somebody else out there that still covers you on a supplement, but maybe a different carrier where your monthly premium can be less than what you're looking at now with your current one.
This is the beauty of working with somebody, A, local, B, who's a broker.
Yes.
And that's the difference between you and I mean, even on television, they have, I see the ads all the time.
Mm-hmm.
And they try and get you to call, use someone local like them. They are, it is a free service to you. No question is a stupid question. And you know what? It is important that you have somebody who can really walk you through. It sounds like what you do is just from A to Z, you walk them right through it so they understand exactly what's happening.
And we did. So we went through what those health questions were before we even talked about an application. Let's talk about what they're going to ask you, and let's see what your answers are going to be to see if it's even possible for you to change over.
So you know those questions?
We can find out those
See,
questions.
they know
and
that
ask
too.
beforehand.
That's awesome.
I was like, there's ways to go and find this information. We'll get it, we'll go through it, and that way, going in, we have an idea if this is going to be a possibility for you.
And what was the outcome?
We were able to change and save him plenty of money, so he
Yeah.
was very excited.
Can you imagine that you get in the mail your letter, there's an annual increase,
Mhm.
and it's $70 more? That's not a small amount of money. That is a lot of money to a senior.
And
I mean, I think
$70
it's a lot of
month
money to everybody.
more.
Yeah,
Yes.
and that's a month. And it hurts, especially when you're on, Social Security and you're on a fixed income. It makes it really hard.
It definitely can, and so that's what we like to look at and make sure, okay, is this gonna work out for you? Is it better for you to stay where you're at? Or what are the other options? So we'll look at all of those things and make sure that you're comfortable with the decision is and it works out for you as from a financial standpoint.
Their phone number to call is 602-750-0620. Check them out. It's Walker Healthcare Advisors with an E.com. So, go ahead.
No, I was just gonna also mention, prescriptions are always a big deal. Everybody needs to understand, how do I go, when do I go, why is it so much when I go to the pharmacy? I will never pretend to be a pharmacist, but I will tell you options for yourself. So if the doctor has prescribed something specific, every single carrier has to have options for you in each drug class. So just because what they wrote for you may be at a higher cost or maybe not on the formulary for you, there are other options for you as far as potentially changing to something else. And if that's something you always want to talk with your doctor about, don't just make the executive decision. You want to talk with them. They know your body just as well as you. So you want to talk to them about, hey, what else is out there that is going to be covered by my insurance company or covered at a lower rate?
I just had that happen myself. I was looking for something, and it was my ex-husband who needed something,
Mm-hmm.
and his the prescription was going to be like $100 and something, and it was a lot of money. So we were looking to see how can we get that lower, and even at the lower price, it was still kind of high. So you answered the question here, whereas you can call your doctor
Mm-hmm.
and say, hey, this is still it's too pricey for me. Is there something else that you can prescribe
Yes.
that you think it would be lower? I don't know why they don't just do that in the first place.
They should, but they don't all the time. And I give them a little bit of grace. I'm like, how many more patients do they have?
Okay,
But-
but come on, give us a break. We have to do the work in calling. And it takes forever for them to answer on top of it, right?
It takes
And
a
to get
long
back to you.
time. Yes.
But what I also like about what you do is, number one, you're walking them through the steps of what it is. And most of the time, well, a lot of people don't even know, so the one thing that they've learned is the RX card, whatever that, what's the name of that one?
Good RX.
Good RX. Yeah, that's the one they all know too. But there's odd times when they don't have that drug on the Good RX. And they think they don't have any other choices. So they just go and they pay.
They go and they pay, or they don't pay, and then they don't have the medication, and we don't want that to happen.
Mm-hmm.
So if you're not sure, what else can I do, then call me and we'll talk about it. Because sometimes even something as simple as going to the manufacturer and asking them, they can send it to you at a reduced rate.
Mm-hmm.
But nobody knows that. And they just assume, like, I either pay or I don't get the medication.
And I bet you most people don't get the medication. They don't want to spend the money.
And I've had clients tell me that. They say, well, I know my doctor told me I needed it, but I haven't gotten it in 3 months because I can't. And so we'll go through the Medicare prescription payment plan. There are other things that are out there for you. Don't just stop because it seems that you can't do it. Call me, we'll talk about what those options are so you can try to get your medication.
The phone number is 602-750-0620. It's a free service to you out there. It just makes sense. Please call somebody local. That's the biggest thing,
Yes.
more than anything. And obviously being able to speak to someone like you in a way that you walk everybody through it. You walk everybody through the whole thing. I love the way you do that.
It's all about education. So I realize the more that you know, the better off you're gonna be. And sometimes people they stop because they don't know who they can trust, and they call, or they try to call that doctor's office, they can't get in. Call me, call us, we'll talk about it, we'll figure out what the next steps are. Because of personal health information, there's so far we can go in some circumstances, but I'll actually walk you through, this is who I need you to call, this is what I need you to say, so that they can get you, they understand exactly what you're needing, and they can help you get what you need as well.
So there's a lot of questions when it comes to being a senior in Medicare, okay?
Very true.
There's a lot of people that are turning 65,
Yes.
right? And you help them as well?
We do. So we go through and we talk about what it means turning 65. And we start.
What does it mean? It means everybody's excited. Oh my God, I get Medicare. And then all of a sudden you're like, oh wow, what did I get myself into? Go ahead.
They have no idea. And I tell them, no, this is actually a good thing. Let's talk about the difference between this employer plan you've been on for all your adult life and now what it looks like to go to Medicare.
Mm-hmm.
And so we'll break it down and talk about what it means, that red, white, and blue card all by itself. If you only had that, how does it work for you? And then once you understand how it works for you, we'll talk about what those other options are to kind of offset costs for you.
Mm-hmm.
And what's going to work best. Is it going to be an advantage plan? Is it going to be a supplement? For everybody, individually, it's different. So we talk about what is best for you specifically, and not you and your spouse. It can work out that it's the same thing, but sometimes it's not.
Right, because you know what? You're two different people.
Yes.
Even if you're living in the same household, you're still two different people. And don't ask your friends, don't ask your neighbors, because they're going to be different than you. Everybody is. But the main thing is that you talk to somebody here like them who are local. If you're turning 65, when should they call?
Call us about 6 months before you turn, and then we'll walk you through what the steps are going to be, how it works. 6
And
months
right
at a
now,
time.
tell them about open enrollment in March 31st.
Open enrollment ends March 31st. If you are looking to potentially change your Medicare Advantage plan, call us. We'll talk about what your options are. We'll get you set before the 31st.
And if you've gotten a letter that your rates have gone up, what do?
Call me up for that too. We're going to talk about what your options are as far as potentially changing the letter of the alphabet or the carrier or both.
They work statewide. This is a free service to you. They're passionate about what they do. You can call them at 602-750-0620. Check them out on their website. It's Walker Health Care Advisors with an E.com.
Thank you, ma'am.